We're on air.
We're on the air, yes. And tonight I'm continuing the chats with the integrative health engineer, Misha Sakharoff. And we've been covering quite a few subjects. And last time we covered the Sakharoff protocol, the Sakharoff pentagram, where we looked at the 5 arms and the fulcrum, which shows that good health, and in fact, if you want to have any chance of curing some metabolic diseases such as cancer, such as diabetes, and that, then you have to find a balance. And one of the arms or legs, if you like, a leg, I think it is actually using exercise and motion to improve improve the other parts of your system, as it were. That's correct, isn't it, Misha?
Totally correct, Steve. And in order to, because we have different areas of health we are working with, yes. And it would be really nice to have an exercise to connect all of them, to make one kind of physical exercise, maybe not one, I have several kinds, but all of this exercise to make them in order to obtain synergetic effect.
Okay, but exercise is many things, isn't it? I mean, some people think exercise is pumping iron. Other people think exercise is running a marathon. Other people think exercise is doing yoga. Some people think exercise is getting off the sofa and reaching for the remote control. So what is optimal?
But we are talking something that is close to yoga, but this kind of exercise is made specially. So we train both mental training, mental stability, resilience against stress. We train breathing optimization. We train physical stability. Yeah. We train joint health, and we train actually immunity. We make lymph drain.
Okay.
Movement, lymph drain.
Okay. And we can do all this exercise. You've devised exercise, a form of exercise that can cover all those things in one go, as it were.
That's
wow.
Right.
Wow, this I want to know about.
Today I will show. It will be a practical session today.
Okay, so you set up your studio there. I can see your studio in the background.
And my studio, there's some background there.
Okay.
And I will talk about both about practical thing, but I will also talk about theory, and I will show everything.
Okay. Well, I hope this ends up being like an instructional video that we can put on YouTube so people can follow. Yes. Okay. So Misha is the guru today.
There's a lot of different aspects of it. So it will never be a totally like instructional video, but it will give people a very good idea of what it is about.
Okay, well, go ahead. Please be my guest.
One of my very good friends. First, a little start. I will just say that one of my very, very good friends. He comes from Moscow, from Russia. Yeah. And he was growing up in Moscow, actually, and he told me about this story. He's a professional. He's a classical musician. Yeah. Flutist and flutist.
Flautist.
Yeah.
Flautist.
Yes. And his first teacher, musical teacher, and his first teacher in art teacher. It was the same person.
Okay. Art and music.
His name is Osip Frolov, and he's now a very, very good, renowned silversmith.
Silversmith.
Yeah, silversmith residing in Copenhagen, and he has a very nice store. If you go to frolov.dk, you see the beautiful things. He makes
frolov.dk.
Frolov.dk, yeah. And and he told a story about this guy. That was his mentor, actually, many years in Moscow. It was a very interesting person. He studied old Indian texts in Sanskrit, and he
In
traveled.
Sanskrit.
Yes, he also read Sanskrit, and he traveled to India many times. And he actually in Moscow we had an institute for Eastern studies, and a part of this institute, it was a very, very huge library.
Yep.
And in this library, he was working in this library, researching old texts about old Indian health systems and old Indian martial arts, because this guy was actually interested in many things. He was also interested in martial arts.
I must admit, I've never heard of Indian martial arts before.
Yes. Actually, very, very strong. And that's how he found something called Dharma Marga.
Dharma, so it's D-H.
Dharma Marga.
Dharma Marga. Is it M-A-G-A like that, or M-A-R-G-A?
Let me write. Like yes, totally. Perfect. And there's many different Indian martial arts. Very strong, very, very interesting. They are not really as popular as Chinese and Japanese martial arts, but very, very interesting. If you can Google or YouTube on Indian martial arts. And Dharma Marga was actually forgotten. What he found in the scripts was a health system and the system, martial arts system, and he start teaching my friend. He was, I think he was one of his first pupils in Moscow.
That's amazing.
Now this guy has a big studio, Dharma Marga, where I don't know, 100
in Moscow. In Moscow.
Yes, and that's he's teaching martial arts. And what I'm going to tell you today, it's something that my friend Osip told me as a part of the health system.
Okay.
Yeah, and this is just a little part of the health system. And I took it very much to me and started to practice it.
Yeah.
I started connecting it with different domains of health.
Yeah.
And what I call it now, I call it three-dimensional multiple purpose exercise.
Three-dimensional multiple purpose exercise.
And it's about joint health.
Yeah.
It's about immunity.
Yeah.
It's about training of one point.
Yeah.
Which is a mental training. I connected with some inspiration from old Chinese martial arts and from Japanese samurai.
Okay.
So all of this in one. There's many components. There's also structural movement. There's a lot of centering, balance, a structural movement, one-pointed attention.
Okay.
Synovial health, joint health, and let's. I will show you something.
Okay.
See, the system is. We are working in 13 points.
13 points.
13 points.
Okay.
And those points are 10 of them are joint points.
Yeah.
And 3 like physical joint points. And 3 of them are virtual joints.
Okay.
Actually, we have 14 joints in the system, but I work with 13, and I will tell you why. Why joints are interesting, because in the joints we have both a physical joint, and the physical joint is interesting because we have, in order to be fully human, a normal person, we have to move, because movement is a part of our DNA. We cannot be human.
There's not many normal people around then.
We cannot be human beings. We cannot be normal people without normal movement. And normal movement is based on joint health.
Yep.
Okay?
Yeah.
So we have the joints, and in the joints we have bones, and we have cartilage, and we have some space between the joints. And this is a cavity. And this space is filled with a fluid. And this we call it synovial fluid.
Yeah.
And this is synovial fluid. It gives nourishment, it gives vitamins, it gives energy to the
lubrication as well.
Lubrication to the cartilage.
Yeah.
So for many of us, it is given that this nourishment doesn't work really good because we are too tense in the joints and we don't move enough, and our movement is wrong. So we press too much on our bones. And the synovial fluid doesn't go between the bones and supply cartilage with nourishment and with lubrication.
Okay, I was thinking also the people who do move. I mean, as you know, I like going swimming, but I find that some of the movements, I lack some of the movements.
Yeah.
Isn't this basis for cross training? That when you're cross training, you're actually trying to move your muscles and joints in a different way than you would in your chosen sport. If you're in a very narrow sport, like
you have to, there's a lot of aspects. One of them is called extending a reach. For example, if you make a round movement from here, you can make it short, or you can make it with extended reach. And extended reach means that the circle you are about to draw, it will gonna be let's say maybe 1 centimeter wider.
Okay.
In diameter, or 2 centimeters.
And that makes a difference.
This is the point. This is the fulcrum. This is the point of movement, and we will make this movement. And if we extend the reach, we make it a little bit bigger, and we extend the reach from here, so the movement will be bigger. You see, when we extend the reach, we let the synovial fluid come into the joint. At the same time, when we make what I call structural movement, we culture our muscles.
Yeah.
We culture our muscles to make full movement.
Yeah.
At the same time, now we extend it into the immunity. At the same time, when we make this kind of movement, structured movement with extended reach, we not only supply the nourishment to the cartilage and train the muscle to culture the movement, we also open for pump function in the immune system, because our immune system doesn't have its own pump. Like, for example, cardiovascular system it has a pump. It's a heart. In order, lymphatic system, which is a part of our immunity, lymphatic system has its own channels, tubular
vessels,
channels. Yes, to have the lymph flow in it, but it doesn't have a pump. So the pump function is enabled by a right movement, by contraction, muscle contractions in the joints. All the joints. That's the strategic places. So when we work with the joint health, we at the same time we enable normal pump function for the lymph.
Okay. So what you're saying basically is that without adequate movement, our lymphatic systems will not function properly.
It stagnates. The lymph movement stagnates, and our immunity doesn't work. Maybe
wow, I didn't know that. It's amazing.
Maybe we have cancer cells somewhere in the body.
Yeah.
And you see, our chemoreceptors or other cells in the body, they sense that something wrong is going on here. It communicates to our brain, and the brain sends, let's say, T lymphocytes or some kind of immune cells to this place, but immune cells travel with lymph.
Okay.
And if we don't move enough, then there will always be some kind of discrepancy. The time, the lack of wrong timing between the signal to the lymph cells, to the immune cells, to come in this particular locality.
Yeah.
But because the highway, there's a jam. There's a traffic jam in the highway.
Okay.
The lymph, they will not come timely to this place, and in this time, the opportunistic organism, it could be the cancer
form of inflammation, for example.
The kind of opportunistic organism, when they have opportunity, they take over, like virus, bacteria, like all kind of organisms that are always in our body, but they are suppressed. They are immunity put a lid on the thriving of this little community of opportunistic organisms. You understand?
Yeah, absolutely.
When our immunity is impaired, and is very much impaired when the lymph function is not working, some of the most normal ways of this impairment is the blockage of lymph vessels.
Okay.
Or lymph ducts, or
the nodes.
Lymph nodes. That's right. The pump function. So it's actually like a one-way valve. You see, it's a one-way valve. Opens up and closes. Opens up and closes. So what we do normally, we hear a lot about manual lymph drain. That's a manual massage when we massage very, very.
You'd always do it back to the heart. Yeah,
that's right. Back to the heart. Yeah.
Or back to the center, actually, not necessarily the heart, but for a lymphatic, you're putting it that way, but you're using what they call effleurage.
Yeah, we always go up from here, and we use this
down
movement
from the neck,
towards these ducts here. Yeah. So, but the problem is that we only need the drain because the state of the lymphatic systems is very, very bad. So,
there's a question come up there. You see the question?
Yes. This opportunistic organism you speak of, that is an extraordinary assertion. Do you have any peer-reviewed scientific support for this incredible statement? Well, there's a lot of support for this. You know, for example, when we're talking cancer, when immunity doesn't work, this opportunistic community of cancer cells, it grows over some levels that our doctors has established for example, different kinds of cancer. When we make blood tests, we make blood tests for some proteins, and those proteins, the number of proteins in 1 cubic centimeter of blood, or 1 cubic centimeter of blood, if it's excess some particular value, then we have cancer. Otherwise, they say that we don't have cancer, but we actually have cancer. All of us, we have cancer populations in our bodies. The thing is that our immunity put a lid on this little community. And actually, we have several communities, not only cancer cells, but also bacteria and viruses, different kind of things. So, well, I call it.
Can I just answer Blue Streak Sky? If you would like to write an email to redgroove@gmail. Because this is something we've seen before. Sakharoff.com.
Yes, I cannot cite on peer-reviewed journal article right now.
No, that's right. I mean, everyone. It strikes me.
Everyone, yes. If you're interested, you write to my email address.
Yeah, and you'll get a peer-reviewed scientific. Yes, you will get this. I must admit, but we get this a lot from skeptics who because
very good. But now I'm not talking with skeptics. I'm now giving information, and then if you want to have something extra, I will give you. Just write to me, guys, if you're interested in some of these things. Contact me, and I will give you answers. Yeah. But I cannot talk peer-reviewed articles live on Blab.
That'd be ridiculous.
It's impossible. It will be ridiculous. Yes.
Yeah.
Okay. Now I'm going.
Yes, we just to point out. Yes, he will support his assertions extemporaneously, extemporaneously.
Extemporaneously. What a fantastic word!
But I know that Misha does extensive research, and everything that I've queried with him, he has actually shown me document. In fact, on his website, if you look at his website, Sakharoff.com, you'll find that it's backed up by, for example, the doctor what's his name, Seidfried, who is quoted along with the research articles.
Yes, all the information on my site, Sakharoff.com, they're backed by peer reviews.
There is no mystifustis, as they say. There's no mysterious.
That's okay.
New Age stuff here. This is stuff that's been documented.
Okay, what we are working now, I want to show you guys the system where, if you understand me right, so every joint we have, it's the point where we can work with multi-purpose exercise.
Yes.
Okay? And that's about joint health. That's about cultured muscle movement, and building up muscle to support the joint. And it's also about immunity. So it's about pumping the lymph. It's about normal functioning of the lymph valves, which is monodirectional valves. So look, I will show you now the 10 joint points.
Okay.
And the 10 joint points are: 1, that's the fingers.
The digits.
All the fingers. Sorry, yes, all the fingers. That's the here. That's number 2.
The wrist.
That's the wrist. That's number 3.
The elbow.
That's the elbow. That's number 4.
Shoulder.
That's the shoulder. That's number 5. No, it's actually not the shoulder. That's the that's the shoulder, but you see, that's this movement. That's number 4.
Yes, it's the shoulder joint, and then you've got the scapula. The scapula.
Scapular joint. That's the number 5.
And the collarbones. Yeah.
Yes. Then we have a joint here. That's number
cervical.
7.
Cervical. Yeah.
Yeah. Number 6.
Yeah.
Okay. Then we have
the hips.
The hip.
Pelvis.
Number 8.
Yeah.
Then we have this joint. Well,
yeah, the hip.
This is number 8.
Well, yeah. The joining of the hip and the thigh. Yeah.
Then we have this joint.
Knee.
That's the knee joint. And then we have
ankle.
And that's the
ankle.
So that's these 10 joints. That's our physical joints. And then we have 3 what I call virtual joints. And the virtual joints are, the first joint is the tongue.
Okay.
The tongue is very, very, very interesting for us here for this exercise, because there's a lymph nodes here.
Yeah.
That are massaged very much by the tongue muscles. The tongue muscles are very, very strong muscles. So if we incorporate some of exercise here, then it will pump the lymph and clear the lymph nodes. And that's one of the most powerful exercise. Then we have eye, also a kind of a joint. Then we have a temporomandibular joint. This joint.
Yeah.
I don't work with it because we don't need further work with this joint. We have to be very, very easy. So we don't work with this joint. The function of lymph movement for that this joint could do, we make it. It's enough with the tongue.
Okay.
And then the third joint we have, that's the joint called the hara. That's the single point of attention, which is I will show you. That is this joint. We have there's 3 centimeters down there. That's
below the navel, yeah.
Below the navel. That's the top of the belly.
Yeah.
And what we do with this joint, we can move actually. We can move it with.
Yeah.
And when we move this joint, we massage all the inner.
Yeah, all the viscera.
All the viscera.
Yeah.
We massage it. And so what is this exercise is about? I call it 3-dimensional because we move in every joint. We make a structural movement in 3 dimensions. Mm-hmm. And these dimensions I called water.
Yeah.
The wall. And the divider.
Okay.
The divider.
Water. The wall.
And the wall. Okay.
And the divider.
X, Y, and Z. 3 dimensions. So what I do, I always start with the fingers because actually I made this exercise very much also before I made this structure called 3-dimensional multipurpose exercise because I'm a musician. So for me, my finger health was very, very crucial.
It's vital, isn't it, if you're a guitarist?
It's vital. I'm both playing double bass. You see here, actually, I have to show you guys. That's the double bass. That's the instrument that requires a lot of
dexterity.
Okay.
Yeah.
This is. And I also play fingerstyle guitar, which requires very extended, and jazz guitar, very extended positions and chords.
Yeah.
And I had many different problems with my hands and with my fingers. I was really interested finding an exercise. And this exercise is we can, from here, without moving the joint, we can make the movement with all the 5 fingers.
Yeah.
If you have 6 fingers, do it with 6 fingers. So this one is the that's we are doing now. That's the wall.
Yeah. Okay.
And you do it clockwise and counterclockwise. Okay. This exercise is called the water. And you see, I do it also with my thumb. It's very crucial to make it with the thumb. So what I do, clockwise and counterclockwise. And then I do this movement in the divider. And you see, you can use the divider like that.
Yeah.
Counterclockwise. Okay? We can do it also like that, but then it will be the same.
And how many repetitions?
We have to do it like that, okay? So
and repetitions.
Yeah, and we do it with both hands. And so that's the first one. The second one is going from here, and we accumulate the movement, meaning that we started with the fingers, with this joint, and we do both these joints and the movement of the wrist.
Okay.
And we do it again.
You support your forearm there.
We do it in every of these 3,
dimensions
in two ways. in every 3 dimensions in 2 ways. So this will be a wall, this will be a divider, okay, and this will be a water, okay, and then we go to here. Then we have you see, I accumulate the movement with fingers, with the wrist, and with the elbow. So, and it looks like that for 2. So I always start with standing, and the standing is the position from Qigong and Tai Chi. That's a neutral position because we have to really relax all the antagonist muscles in order to let the flow, enable the flow. So what we do, I do this.
Yeah.
So that's the wall, that's the water. Okay, in another way, and that's the divider. And very often when I make one movement, then I change it. I make a nade.
Okay.
A nade. And then I go in another direction, and then I make a nade. Okay.
Okay.
So this is for this joint. So we accumulate, we make this. We can really use extension because the extension means we extend just 1 centimeter the joint. That's the feeling of extension. So this circle you're gonna make is gonna be a big circle. Okay.
Yeah.
And so on. Actually, now you go with the head. And you do, with the head, you do very, very slow movement. Very, very slow movement.
Okay.
Then you go with the shoulders. Then you go with, then you start from here. That's also, then you start from here. You do also, that's the water. That's the divider. That's wall. Then we go like that.
Yeah.
Then we go like that. You see? Then we go like that. It's a very, very good stability exercise. And that's the so there's a lot of different exercises. You see, the stability is very, very crucial here.
It teaches you balance, but it's especially important for older people.
Because our physical balance is very closely, tightly connected with our mental balance. And because of that,
that's true.
I also incorporate this thing. Yeah.
Flying saucer.
I use this one for my new pupils. Yeah.
Okay, because it's got a flat bottom.
For advanced.
For your advanced.
And what I do basically, I will show you on this one. What I do is the first thing I do. You see it from here?
Mm-hmm. Needs to be down a little bit more. That's better. Yeah.
What I do with this one, the first thing, because I'm playing tennis almost every day, and I had a lot of problems with the ankles, and that's why I started making this exercise, and I found out that it's very, very good for stability, and I never have any ankle problems since I started with this one, and the ankles for us are crucial in the movement because the ankles give us stability. So we have to train the ankles. And what I do, I stand like that, and then I relax my diaphragm, my breathing muscle. And you see, the focus here goes to Hara, to one point. And very, very slowly, I'm going, and I have to be totally straight doing this. So what I do the whole round like that, okay? And then when I came back to the same position, I do it another way, okay? Another way, also 360 degrees in other direction.
Yeah.
So now we have an extra aspect to this. We just added an aspect of mental training, because all of this exercise has to be made with focus in one place. And this place is this hara point. What it does, it's mental training, but physiologically grounded mental training. Which I use very much for. So what we have here, okay, now Steve, we stop this discussion, okay? Yeah. Blue Streak, if you want to communicate with me, please write to me. We will not. We don't have time to have a big discussions here. It's. I appreciate your point, but please write to me, and let's talk about this. Okay. So because there's a lot of people are listening, and I don't want to just talk with only with.
No. But the comments don't come up in the replay, so that's okay.
Okay, so what have we've been talking about?
We're talking about the balance. You have to incorporate
this point, and I use this point very much when I work with people that have cancer, because this point, when we train this point, it gives the people that have cancer, and often the deadly cancer, the terminal stages of cancer, they have some very, very big fear. And they are in the thoughts all the time, in the feelings. To work, they need.
I think you have to repeat that sentence. You froze for a minute after you said fear of death. Cancer patients had a fear of death. What did you say after that?
Yeah, in order to work, because when I work with cancer clients, they really have to have extensive work every day, and we are reporting through our reporting tool, and it's like 20-25 measurements every day, and we're working for half a year every day. Extensive.
That's very intensive.
In order to work, because they are healing themselves, and it's not new age aura or something else. It's just it's a physiological thing. Yeah, that's pure engineering.
Yeah,
yes,
pure engineering.
So So what it does. It trains you to remain in one point, and to have a very strong connection to your senses, and that enables you not to think too much and not to be in the fear. You understand? So
so you overcome the fear, because fear is the worst enemy. Yeah.
So and it's a very strong tool. I'm training it. When I started training, I did it with with musicians, and then I did it with elite athletes. I still working with both with professional musicians that have stage fright, and this is a very, very crucial point, and it helps very much. I have a special site for musicians, and I have a special site for athletes. I work a lot with tennis. People with tennis. It's called breathingfortennis.com. And dancingsword.dk,
Yep.
it's for stress performance, for performance. So when we train having attention, focused in this point, have the focus in this point, focus, and do the physical exercise from this point. So we have 4 dimensions here. Okay? And when we are starting to move and make a movement, then we also add postural training, posture and structured movement. So there's a lot of very, very good things in this. So that's about how we make multi-purpose exercise, and we are connecting joint health and immunity in practice. Any questions? Any questions, guys?
Right.
So if you have any questions.
Well, I'll just start off one. So what is the? You obviously have to get into routine and some sort of regime here. So how many repetitions and how often and when? What time should you do this before you eat in the morning? Should you do it before you go to bed? I mean, when's the optimal time to do this, and how many repetitions should you undertake?
I always answer that you have to you have to sense what your body is telling you about. I don't actually normally say repetitions or how many times you do this or that exercise. That's the part of your Hatha training. You have to listen to your body all the time. And that's what Hatha is about. So I cannot answer this question, but it can be very different from day to day. That's one of the part of this training is to avoid injuries. And in order to avoid injuries, we have to listen to our body. And very few people really are able to do it. And I know many professional athletes that absolutely cannot listen to their bodies. That's why they have injuries. That's why always they drive themselves somewhere in the outer position of their
envelope. Yeah, you see that with professional, very often professional athletes such as soccer players, American football players and everything. Because there's so many financial pressures, etc., on, they push themselves to the limit. And they end up being almost totally on painkillers such as ibuprofen or whatever, which obviously causes huge damage in other parts of their system.
Yes. I have
that's true.
My younger son, I have 2 boys, and 19 and 24, and the younger of he was a professional football player since the age of 14, and he played soccer from 4.
Wow.
And he was professional from 14, played for Danish national soccer team, junior and juniors. And so I know this thing about the injuries very, very closely when we're working against injuries, and we're working with mental training and connecting all of these things. So I've been actually connecting these areas together with my own son, and then taking it further to my different kind of students.
Yeah, someone just asked me a question here. In what capacity have I been involved in professional sport in my life? No, but I'm a qualified masseur, and I've certainly given massage to at least semi-professional soccer players and squash players. My own sport is squash. I didn't play it professionally, but I played it at quite a high level. So, how I can make statements not being involved. Find out as to how I can make statements being involved. I'm just being a part of the audience here. I mean, I'm just part of the audience, and I'm just interested in asking questions, because what the message is from Misha here is to get a message out to people, to families and everything. As you know, as I know, cancer can be a very devastating thing, not only to the person who gets cancer, but also to the relations and the friends of the people who have cancer. And my interest here is that I think what Misha does is makes perfectly logical sense to me, and is if it can help people get better, then I support it.
But what I do now, actually, the part of what I earn for living, I'm invited different places in the world by doctors. There's 2 doctors in Israel that I will make the workshop in 2 weeks. I'm going to Haifa by 2 medical doctors. Then I go to Ireland. Then next year. Then in February, I'm invited by Breathing Association of Sweden to make a lecture on the connection, how we can make without drugs, help people cure their cancer without drugs, healing without drugs. But there will be doctors there too. So I will be one of the 6 speakers, together with doctors and different kinds of interesting people. So I work with a lot of doctors, actually, and I have some doctors among my clients. So I definitely think that it's very, very interesting what I'm doing myself, and I really love what I'm doing. I'm burning for that. I'm engineer, and I feel that now I'm working really as engineer because I love human physiology, and I'm connecting different areas of physiology as an engineer, as a very, very practical engineer. And I'm reading peer reviews and scientific research every day. That's a part of my day. I get up at 4 o'clock every morning. So I have very long days. And, last of my clients, my day is my working day stops at 6 o'clock in the evening. So I get up at 4. I work. I check my clients' journals. Then I'm on tennis court at 7 o'clock with a trainer, and then I'm working with clients. So it's a very long days, and I enjoy my work.
I think it's valuable what you're doing. I mean,
valuable what I'm doing, and I have. Yes, I think sure I'm valuable. It's valuable, and I help a lot of people. So I both train breathing instructors because I'm certified.
Of course, Buteyko breathing is something that I suppose the skeptics would say that Buteyko breathing has never been proven or had a double-blind test and what have you. But the short answer is that it works.
There's a lot of blind tests about both the ketogenic nutrition is, there's a lot of tests, peer review, absolutely. All of this information you could find on my site. Buteyko was also peer reviewed.
Yeah, but then again, at the same time, Misha, when Coca-Cola sponsor a research into sugar, the end result is that sugar is no damage in health, and sugar is perfectly good for people. So there's research and there's research, isn't there? You can always turn research to whatever result you want to get.
Yes, but Blue Streak, Sai, you are actually a very good question. Why don't they test it? Can you answer it for me? Because for example, ketogenic nutrition is one of the biggest thing right now in the world of nutrition. Ketogenic, how it works. But the medical profession, what they are interested in actually now, and the industry, they're interested not in promoting self-healing without drugs. They are interested in making a drug that mimics
ridiculous
ketogenic nutrition, and it's selling this drug. That's ridiculous. You see, instead of just normalizing our nutrition, because what I work with optimization, and maybe I will. I don't know. You will look some other labs when I'm talking about my protocol. So, and Julian, that's right. That's the too many conflicts of interest in a lot of research, and that's generally what is a problem. And there's a lot of people working as specialists here, what I feel I can contribute with as engineer. It's to make a balanced routine or a balanced protocol where we work both with physical movement, with promotion of immunity, with optimization of breathing, with optimization of nutrition, and also mental resilience. So what I call, again, I can tell you guys, if you haven't heard our other blabs, I can tell you in very, very short what my protocol is about. My protocol is about two things. The first thing, we optimize acquisition of energy from the environment. And what we do, we optimize acquisition of nutrients, macronutrients and micronutrients. And then we optimize acquisition of oxygen on the cellular level. That's about energy acquisition from the environment. And when we have this energy in our body, then it's about distribution. And we have this triangle of distribution. I call it a resilience triangle. And this triangle is three kinds of resilience. We have mental resilience, physical resilience, and immune resilience. So all the exercise I'm doing is around the center point of Hara, which is acquisition of energy. And it's this point in the center of resilience triangle. So that's how we optimize acquisition of energy from the environment and the distribution of energy in our body afterwards. And I described a lot. There's a lot of articles. There's a lot of different interviews in my site, and you are very, very welcome to write to me. I'll do my best to answer your questions. Really. So and now I'm actually the guy who wrote "Cancer is a Metabolic Disease." Dr. Seyfried. He asked me to. He actually asked me to publish the article together with me about the case. One of my clients with chronic CCL, that's a chronic lymphatic leukemia, CLL, chronic lymphatic leukemia, that I've been working with now for 7 months, and he's in remission without any other things that my protocol, no drugs at all. So yes, so that
what journal are you going to publish these results
article, and then maybe we can make some. I don't know. It's I never did it. So Professor Seyfried, he's a professor of Boston University. He has a lot of publications.
Can I just say something to address? Now, I'm sure the gentlemen who, if they're not gentlemen, it might be a women as well, are coming from the scientific side of it. I'm basically interested from a layman's perspective. Look, I think I'm right in representing many people who have seen the dramatic rise in the incidence of lifestyle diseases in the past 20 or 30 years. And my conclusion is, or my conclusion, but my ongoing, if you like, research has shown me there's a combination of environmental factors, wrong diet, lack of exercise, all these things that our modern lifestyle in the West, that we're exporting to China, India. And in my opinion, the medical industry, or the doctors, in fact, are very slow in coming up with answers. So like many other people, I can say that I'm extremely skeptical about the ability of the medical industry and the medical establishment to actually tackle these problems. That's why for me it's very interesting when someone comes along and comes from a different perspective and comes from a holistic perspective, where instead of we're looking to treat the symptoms of the illness, we actually go to the root cause and treat the patient. We are preventative, just like Chinese doctors were 5,000 years ago, where they were responsible for the health of the village, not treating the sick. And that's my perspective. And I'm sorry I sound a little bit hard about that, but
That's right, but you see, that's totally,
what, a
you're right what
pathological
you say.
disease
In
is
the
a
blue
cure.
streak side, do people live longer or shorter? They live, some of them live longer, but the problem is that they live longer because of life support. It's not natural. The part of the answer is life support. And you know what? You are asking me all the time about what journals I'm publishing the results. I'm not interested in publishing the results
Misha.
right now so much as helping the people.
Yeah, lives are more important than journals. Lives are more important than journals.
I'm sorry for that. I don't give a fuck for medical journals, really. So right now,
good for you, Misha.
I'm just.
And I'm sure the people that you helped cure themselves of cancer are extremely grateful, and they're not sitting there. They're not sitting there.
Yeah, but it's not only cancer. I work with people with diabetes 2, with diabetes 1. I work with people with asthma. I work with people a wide array of diseases. And I use only non-medical
no supplements,
cures, no medications. Well, supplements is an interesting thing because there's a possibility to measure what supplements they need, because we count all the macronutrients, and in my new system we'll also count all the micronutrients every day. So I will be able to make an assessment of the
because not everyone's
the macronutrient needs
yeah.
of a certain person.
Okay, well, he said he wants to use him as a case study. Julian, 1973. I don't know if you know that person, but
guys, if you want to communicate with me, case study means that you want to be my client, and that's very good. We can make a case study for sure.
Breaking up there, Misha, badly. You seem to be broken up.
Not a problem. Can you hear me? Hello. Very good.
There we go.
So
yeah, now we can hear you. Well, I don't know what happened.
So yes, guys, if you have any other questions, please ask me.
You know, I would have agreed with Blue Streak there, and that's the answer my wife gives, and she's a nurse, right? She says that people don't get infectious diseases, and they live long enough to get diseases that affect older people, cancer, dementia, etc. But do you not agree that these lifestyle diseases are affecting younger and younger people?
That's you know, I can say that maybe you are Blue Streak side, maybe you're not or you never thought about this in this way, but we have this pandemic reach of diabetes, pandemic of asthma, diabetes 2, pandemic of cancer,
diabetes 2.
Never diabetes has had so big reach on the populations in the world,
neurodegenerative disease,
nor asthma has ever been as big. nor cancer. You know,
and dementia and Alzheimer's.
WHO and made a prognosis that in 72 that the 4% of us will have cancer in our life, and now the prognosis for the generation of my sons will be 45%, up to 45%, and that's 10 times. That's 10 times. And you see, you have asthma, so you know everything about it. You know everything about it. Yes.
Yeah.
You know.
Well, you can help Blue Streak very much. So.
Asthma with ketogenic diet and with Buteyko system. If you work hard, in 2 months, you will say farewell to your asthma. And if you will keep on doing the exercises, not in the big amount, but the exercise will be a part of your life. It's just changing of breathing patterns. Buteyko method is about actually changing the breathing patterns 24/7. So medulla oblongata, that's the only, as well as I know, breathing retraining method that reprograms your automatic breathing patterns 24/7.
Okay, I mean, you could, the alternative is, and this sounds very bad, maybe, but you could, and this is what many of Misha's patients, Misha's patients had a very stark choice. They could either work at something to cure themselves with his assistance, or they could die. I don't really think many of them were standing there going, yeah, but where's the scientific paper, Misha? And if you want to seriously...
clients, you see, the official medicine has just abandoned them and say that the only place they ought to go, it's the, how do you call it? The place, the last place, the home for people that have cancer.
Yeah, you have to go to a hospice. Yeah. The only place you can go is a hospice.
With some of them, my patients, I work from the hospice. So, yeah. So, guys, I will tell you, it's it's very nice to talk to you, and very good questions. And thank you very much. Both Blue Streak and Julian. And
yes, and I appreciate the question as well. And all I can say is that please have an open mind.
Yes,
please have an open mind. As Haldane, the famous chemist Haldane, said to his students, 50% of what you learn from me in 5 years will be proven wrong. The only thing is, I can't tell you which 50%.
That's a good one. Yeah, we have to be very open-minded because something happened. Yes. Yeah. So we have to remain open-minded and listening to each other, and not being triggered by emotions.
Well, it is emotional, though, isn't it? It's emotion because it's life. But
that's very emotional. But yes, still, the thing is that when, actually, we can understand each other. If we listen, we can understand each other very, very good.
No, you're right. Yeah. But the other thing I really think is important is that what. There is a saying that says nothing is new under the sun. Nothing is new under the sun.
That's right.
And a lot of things, what you've done there, Misha, basically you have put in a modern Western context what have been true philosophies since you talk about China going back 5, 6, 7,000 years, and India and what have you. And Japan, that these the Eastern philosophies do have these systems, basically because they've been looking at and reflecting on these problems for thousands and thousands of years.
And another thing, there's some oral tradition of giving things to the masters, giving the knowledge to the students, to the pupils.
Yeah.
And this oral tradition is very, very strong tradition too. In our life, we don't have time really for slow mastery, and this slow mastery that has, I think, has a very big value, because when we are evolving slowly, we have actually time to absorb a lot of different impulses from the environment, and not just say, "Oh, it doesn't matter because I have to go this way. My goal is there. I can see my goal almost. So this is not important. This is not important." And in the old times, in the time of this slow mastery, there were time to all these aspects. And I think that in some way, this was like a wider horizon for the practitioners, be it health or martial arts.
Yeah, you're right.
So,
anyway, should we wind it up there? I think we've been going for just over an hour.
Yes.
It's very interesting.
And if you guys some people just joined lately, you can always see replay.
Yeah, but I do recommend that you have a look in depth on Misha's website, sakharoff.com.
Yeah.
There's a lot of information there. I mean, it's I use it as very much as a reference point when I want to find out something when people ask me. So I always go to his site and find out. It's some very good, very well researched stuff on his website. So I do recommend it very much indeed. And thank you very much for showing us the Dharma Marga exercises. And now I know a bit more. I'll be able to do it. Yeah, like the Muslim movements, they do it for more than 1,400 years, 5 times a day. We move joints and muscles.
Very good one. Very good.
There we go. There we are.
If you smile and move your smiling muscles and the joints, and you believe in the goodness for humankind, nothing can be better than that.
That's right.
It doesn't have to be religion, but if religion is like that, this is perfect. Perfect. It could be without religion too, moving muscles, and it can be with religion too. And I love both. If we can talk together, that's perfect.
If people can find a common thread and common understanding,
sure,
through these things, then I think the world would be a much better place.
Because you see, the religions. Actually, I think I'm not I don't have a profound knowledge of religions, but I imagine that all the religions, they started as the belief in something very good in humankind and in people, and to promote the ability to give this goodness to each other. And then some of all of the religions actually became institutions, and institutions to good things. It's perfect. It's perfect. Steve, you are okay. Guys, thank you very much for joining us. And we have a YouTube channel, and I have a YouTube channel, and I have a site. It's called Sakharoff.com, and my mail is Misha Sakharoff.com. And on YouTube, we have a channel called Breathing for Living by Misha Sakharoff. Breathing with A, yes. So please follow me and Steve on on Facebook, Twitter, YouTube, whatever. And this is a weekly or bi-weekly session we have here. So please join us. We will be very happy to inspire you. And please send us messages. If there's anything we can help, we will be very, very happy. Thank you very much. I will post a replay, and have a good evening. Have a good morning. Thank you.